Alright guys, so just a quick little introduction video of how you're going to add a patient into the system to make an appointment. So when you first log into your individual Office Ally account, you should pop up to either the screen that says desktop or the screen that'll say appointments. Doesn't matter which one, just make sure you're in PracticeMate. Go to the tab where it says appointments. You're gonna want to click on the date that you guys are actually at the clinic or whatever event we're at. Okay, so then from here, you're basically going to have a blank sheet if it's your first patient. What you're going to want to do is go to the little pencil where it says add. You click on the pencil. At this point, you have a couple options. Seeing how some patients might have different names, it might be easier if you search a patient up by their date of birth. In this case right here, because the patient is test, a little fake account, I'm just going to do that. I'm going to add it to test. Okay. From there, you're going to scroll down to the bottom. It's going to give you a couple options. It's going to ask you, what's the reason for the appointment. So me, Steph, and I think Mike kind of quickly just made this reason list when we first started doing the EMR. So these are the ones that I was telling you guys that we can change going forward for the telemedicine. But let's just say, for an example, that the patient wants to see Jen that day, whether it's telemedically or however we're going to going forward. You would click on that option. Do not worry about the color. It automatically gets picked on this little screen. So once you have test, he's going to see the provider, whether it's Jen or a covering PA. You're basically going to, just hit update. And he's been added. So depending how we go going forward, there's a couple cool things we can do on here. One of them is going to be you can check in the patient. It'll open the screen up. You scroll down, there's a little box that says check-in time. You can click that, and it'll timestamp the time the patient got there. Give or take 2 minutes that it took you to do this process. And then you're done.